Hello, my name is Linda Mishansky, and I'm a volunteer with the Duke of Edinburgh International Award Program. To help you meet the requirements of your preliminary training for your adventurous journey, we have developed a number of informational videos. At the end of the video will be a means for you to document you have fulfilled the requirement with either a certificate or some sort of authorization that can be printed off or downloaded to your online record book. In this video, I will be reviewing some very basic first aid concepts. You are very strongly encouraged to take a recognized first aid course. First of all, here's a guideline of what to take in a wilderness first aid kit. The quantities and supplies will depend upon the length of your trip, the number of people, and the level of formal training that you have. The ideal first aid kit should have multifunctional components to reduce cost, bulk, weight, and simplify use. It can include adhesive bandages, an assortment of gauzes, triangular bandages, alcohol swabs, tweezers, and also some safety pins, some kind of adhesive tape, compression bandages for sprains and stains, additional cleaning supplies such as Q-tips and pads, roller gauze bandages, some kind of a blunt scissors, topical antibiotic creams such as polysporin. Also have some instant cold packs in this one, again to help with strains and sprains. I also have some sweet treats for in case somebody has a diabetic episode or is just low on energy. I also have some hot warmers to help warm up somebody who's cold. For medications, Tylenol and Advil are both a good thing to take. As well, I have some Tums for upset stomachs. If you do have things such as your polysporin or your Advil and Tylenol, make sure that you check the expiry date and replace them as required. Some other things that you might also include is an emergency blanket, or if you have somebody who has severe allergies, you may want to ensure you have an extra EpiPen and also some kind of antihistamine. Calamine lotion is also a good thing to have for insect bites. I will now go over some common injuries and how to treat them. By no means is this a comprehensive list. If any of the injuries are major or are beyond your ability to treat, do what is required to prevent the injury from becoming worse and seek medical assistance as soon as possible. First of all, soft tissue injuries. These will be 90% of your injuries. They include mostly cuts, scrapes, and punctures. If the site is bleeding, control with direct pressure using a clean gauze pad. Once the bleeding has stopped, clean the area by exposing the injury and then wiping any dirt or debris away from the wound, being careful not to dislodge the blood clot. Any dirt in the cut itself can be flushed out with water. If the gauze is stuck to a major wound, do not remove it but clean around it. When you have cleaned the area, apply some antibiotic ointment and cover with either a bandage or a gauze secured with roller gauze and tape or a triangular bandage. Monitor the wound, replacing the dressings as required, and if infection starts to set in or is a major wound that is hard to control the bleeding, seek medical attention immediately. Minor musculoskeletal injuries. These are your strains and sprains. Use RICE. R, which is rest the area for 24 to 48 hours. I, which is ice the area for 5 to 20 minutes every hour for the first 48 to 72 hours, or until the area no longer looks or feels hot. C is compress the area by wrapping it tightly with an elastic bandage or triangular bandage, and E, which is elevate, to help reduce the swelling. Keep it elevated while you sleep. Take ibuprofen to reduce inflammation and swelling. This is also known as Advil. Once the area begins to heal, gradually use the area with support, that i.e. walk with a crutch. or a hiking staff. If a joint is out of place, do not try to reset it. Secure it in place and seek medical attention as soon as possible. Blisters. It is best if they heal on their own. Use moleskin to tape and reduce friction. If the blister opens, treat like an open wound. Do not puncture the blister. Sunburn. Prevent it by using sunscreen and keeping the skin covered. Cool sunburned areas with tepid water and protect from sun and additional friction. Minor hypothermia. Remove from the element, i.e. take out of the water and get out of the wind. Remove any wet clothing and put on some dry clothing. Drink warm, sweet liquids. Keep the person warm and apply heat packs to core areas of the body if necessary. Diarrhea. The body is trying to flush out whatever is causing the problem. Keep the person well hydrated. Watch for increased nausea, fever, and vomiting. It generally corrects itself in 12 to 24 hours. If not, something else might be happening and you need to evacuate the person. Burns. Cool the burnt area for 15 to 20 minutes or until it no longer feels warm. Cover lightly with a dry dressing. Do not apply any kind of ointment or open any blisters that might form. Keep the person hydrated and watch for shock and infection. For serious burns, seek medical attention. Headaches. These are often caused by dehydration. Try rehydrating the person before giving any kind of medication. Coughs and colds. These may be allergy related. Take any medication if required. Do not get chilled and ensure you have lots of rest. Poison oak and poison ivy. Wash the affected area with cool water and mild soap. Sores are not contagious once the plant oil has been washed from the area. Severe reactions may require medication and medical assistance. A urinary tract infection. These are most prevalent in women. It can become severe if it travels to the kidneys. Keep well hydrated to flush the urinary tract. Evacuate if the person is in severe pain or if there is blood in the urine. Allergies. Either remove the problem or remove the person from the problem. Take an antihistamine. Insect bites. Watch for anaphylaxis or the swelling of the airway. If the stinger is present, remove carefully by scraping the skin. To relieve irritation, rubbing alcohol or a baking soda paste or calamine lotion on the bite. If required, assist the person to administer an EpiPen and seek medical attention immediately. Objects in the eye. Flush the eye with cool, clean water. Check for eye injuries. If an object cannot be removed by flushing it, do not apply any pressure. Keep the person at rest and cover loosely with a gauze and seek medical assistance immediately. Heat exhaustion. This is very common. Rest and rehydrate and cool the person slowly by placing in the shade or placing cool cloths at the back of the neck. Slow down and drink lots of water. Small impaled objects such as splinters or in some cases fish hooks. If possible, remove the object, wash the area with soap and water and bandage. Watch for infection. If you are unable to remove the impaled object or doing so will make the condition worse, such as a barbed fish hook, stabilize the object with clean gauze and seek medical attention. Rashes. Wash the area with soap and water. Keep clean and dry. Minor fractures. Splint and stabilize above and below the break. Seek medical attention as soon as possible. Dehydration. Prevention is the best treatment. Always drink lots of water. Leeches and ticks. Dislodge a leech by applying salt to the body. Remove ticks with a tweezer by grasping as close to the skin as possible and pull away with an even, steady pressure. Cleanse the area with rubbing alcohol and monitor for infection or development of a rash. Frostbite. Prevent by limiting exposed skin to the cold. Skin-to-skin contact will help with first and second degree frostbite. Third degree frostbite requires immediate medical treatment. And unconsciousness. This is caused by many conditions such as blow to the head, shock, heat stroke, diabetes, or a heart attack. If you find a person unconscious, seek medical help immediately. If they are not breathing, perform artificial respiration. Control any severe bleeding. Place in the recovery position if possible. Loosen any constrictive clothing around the neck, waist, and chest. Do not give anything by mouth and keep them warm until help arrives. For more serious problems or in case of a serious accident, avoid further injury to the victim, to the group, or to the first aider. Maintain and restore breathing and circulation. Control bleeding. Guard against shock and reassure the victim. Position the victim correctly but avoid any unnecessary movement. Treat the conditions to the best of your ability. Obtain help and arrange for the victim to be evacuated. This is some very basic principles of first aid. Again, you are strongly recommended to take a formal first aid course from a recognized agency. Thank you.